Very well. My name is Mohammad Hammami, and I am a speaker at the conference. I am the Chief of Health Operations at Wayne County, Michigan. Wayne County is the 13th most populous in the United States, and we have so many different diverse cultures that live in the county. So it is very befitting that I will be talking about the importance of cultural competency in international medical care. Well, professionally, I oversee everything related to health in the county. So if we look at the complexity of Wayne County as a community, we have, for example, the largest concentration of Arab Americans outside of the Arab world. We also have a large population of African Americans. We have a decent size of Hispanic Americans. And also within each culture, we have a diversity within itself. So for example, when you talk about Arabs, we're talking about 23 different countries. As well as the city of Detroit has a large population of Chaldeans. Now, Chaldeans are mistakenly labeled as Arabs just because they come from Iraq, but they have their own language, their different religion, and different cultures. So it is very important when we are tailoring anything, whether it is clinical care or, in my role, for example, public health, it is very important to pay attention to the needs of such communities and cater to their differences. It is not one size fits all, as we used to think in the past. There are so many differences within a culture that we have to make sure that we address. It is very important. There has been, in the past, we used to advocate for cultural sensitivity, then we evolved to cultural competency. I think we need to be even beyond competency. We need to really immerse ourselves in culture. And that is very important for industry, especially in medical tourism, where depending on what is the most dominant culture that your patients come from. So there has to be a way of coming clean and addressing the culture that you are serving. Maybe certification in cultural competency is not something that institutions are heavily involved in, but many of them are now understanding that they cannot do business without it. So I would hope that in the future we will have culturally certified institutions or healthcare systems and hospitals. The sessions, especially those that are labeled for continuing medical education, are very thorough and very well thought of. The issues that many of the speakers are going to address, or they've already addressed, are very relevant as well as important to anyone who is in the healthcare business, not only those that are in the international market as well. So whether you're a physician or you're a facilitator, these are very beneficial to attend, and the educational sessions are very highly organized. I have attended this. This is my third time, and I was also fortunate to be invited to the one that was held in Jordan at the Dead Sea. And I think this year there is a greater diversity, and I see that the attendance level has increased, and there are so many different topics that are of interest. It's a long process, but as they say, how do you eat an elephant one bite at a time? I think the first step is awareness, absolutely, and the second is to have a system in place that addresses the cultural needs of your patients. And if you need to know more, then you better attend my presentation.